All right, everyone, good afternoon. I hope everybody's been able to get some lunch and take a short break to stretch after our morning sessions. We are going to move into an overview of the evaluation methods for PCORnet right now. And for that, we've got four speakers joining us, Sarah Green, Sarah Doherty, Aaron Holvey, and Eric Schneider. So we're going to get going with their presentations right now. So I know lots of discussions going on. Actually built into the next session is some more time for table discussion, so we'll come back to that as well. But right now I'd like to get our evaluation session going, so I'll turn it over to Sarah. Thanks.
Thanks, Mark. Please do enjoy your lunch, and I'm going to go through a couple of slides that initiate and frame and set up the evaluation work that we'll be doing, and then Sarah, Aaron, and Eric will each take a minute to share their piece that they'll be leading for the PCORnet evaluation, and then I'll moderate some questions. Hopefully we'll have about 20 minutes for that piece. So let's see. So we're calling this multiple part singular goal, and I think you'll start to appreciate that we have a lot of different aspects of PCORnet that we want to evaluate, but all leading up to the same sort of end game. I'm a big fan of the Start With Why movement, and always want to begin with sharing the rationale. Why are we evaluating PCORnet? We feel that this really represents an unparalleled opportunity. It's rare to be able to study the building blocks of a network while you're building the network, and so we wanted to capitalize on that opportunity and understand what the ingredients are for a successful, sustainable, durable infrastructure that PCORI can use going forward and that the PCORnet partners can use. As partners, all of you and your network constituents are ideally positioned to help us understand what it's going to take to optimize the network. So what we intend to do is give you information that you can use with your networks, not just us taking information from you and using it, but making sure that you get something in return. And importantly, that you have a chance to contribute to how we go about this. So you'll hear more about that from especially Sarah and Aaron. So the other thing I want to make sure that everybody walks out understanding is that this is all a bigger piece of PCORI's overall strategic plan. We take very seriously the notion of learning from what we're funding. And so as you can see in this slide, this is taken from PCORI's strategic plan. We're looking at the sort of before, during, and after funding as three pieces of a cycle. And what we're really doing is trying to fit in that evaluation box, after funding. How do we learn from what we are doing here? Okay, 5 minutes already. And so further to that, we have three components. We're using it as the three-legged stool metaphor is what we're using here, and it's been useful to conceptualize it for us. So we have. We're going to be evaluating patient engagement, and Sarah Doherty is leading that from PCORI. And Aaron is leading what we're calling the internal self-evaluation, and we're really coupling that closely with the monitoring work that I and the other program officers for PCORnet will be undertaking. So we view that as of a piece, of a leg of the stool, if you will. And then finally, Eric Schneider from RAND is leading our external evaluation. You might notice on the slide that the pieces that Aaron and Sarah and I are leading also include technical assistance. So again, we want to learn from you and give information back. The piece that Eric is leading will not have a technical assistance component. We're committed to ensuring, I'm going to say this a couple times, we're committed to ensuring that this is usable information. We understand that there can be a lot that goes into an evaluation. Some of you might be viewing this with, what? But in fact, we really want this to be minimally burdensome and maximally useful. So we're going to be very disciplined. The four of us are working very closely together to ensure that we only collect data that we or your network can act on. We're going to be judicious in how often we ask you for information, and we're going to be very coordinated to ensure that through and through this is a very efficient process. This is a snapshot of the timeline. I'm not going to belabor it because we're still I think piecing together some of the intervals, but I just want you to see that we are, again, PCORI and Academy Health are working together to ensure that the monitoring and the program officers need to check in with awardees, that's tightly coordinated. And then the engagement survey will happen, we believe, at 3 time points, baseline, mid-course, and toward the end. And then finally, the RAND evaluation will be kind of a through-and-through activity with some interviews we are anticipating for the last 3 months of the award period. And so with that, I'm going to turn it over to Sarah Doherty, my colleague at PCORI. Thanks.
Good afternoon, everyone. I'm Sarah Doherty. I am a Senior Program Officer at PCORI, and I am going to be working with 9 of the PPRNs. So for those of you that I haven't met yet, please come up to me. I would love to meet you face-to-face. I know we've already had our conversations by phone, and I look forward to continuing to engage with you in the future. As Sarah said, I am also helping to lead the Patient Engagement Evaluation Initiative, but I've really been doing that in collaboration with my engagement and evaluation colleagues at PCORI, my colleagues at CMTP, here represented by Sean Tunis and Pat DeVarca, and my colleagues here in Academy Health and RAND. So we've really been trying to coordinate our efforts on our end, and we wanted to make sure, and I wanted to communicate to you in my few short minutes, that you are our 5th and most important partner in this evaluation process. So I wanted to try and quickly answer 3 questions. The first is, why do we think we need to conduct a patient engagement evaluation? The second is, what type of evaluation are we thinking of, and what is the process that we, to date, have conceptualized to create an evaluation tool? And then the last is what we hope to see at the end of the 18 months. So to start with the first question, and it's appropriate that we're following the patient engagement session, because as you all probably know, there is little evidence out there on patient engagement in infrastructure development. And so you all are you are going to be exploring uncharted territory, and this is a new frontier, and we want to stand there with you at that frontier and explore it. And so as Sue had said previously, and Sean had emphasized as well, this is really an opportunity for us to facilitate a peer learning opportunity and for us to learn from you all about what actually is working well and what's not working well in practice. And so I just wanted to come back to Sharon Terry's comment that she had made yesterday about the importance of sharing our successes and our failures, because you can learn as much from your failures and the barriers and challenges that you encounter as you can from those things that do end up going well. So I also wanted to mention, as Sue had said, PCORI is not being prescriptive with how and when you engage your participants. So those are pieces and aspects of the patient engagement that we would like to learn from you. So the diagram that I set up here, to move on to my second question, what type of evaluation are we conceptualizing? We want this to be a formative evaluation, and in other words, we want this to be an opportunity for you to gather the information, to see among the 29 different partners that are taking 29 different approaches at this point, what's working well for different partners at different phases throughout the infrastructure development. And I really think actually our heterogeneity at this point is our strength, because each of you are coming in at different phases. And so you will be able to learn from your peers who may just be one step ahead in the infrastructure development process. And then to finish the circle, what we hope to do, and as Sarah had mentioned, we really want this evaluation to be focused on utilization. So whatever information we collect, we want it to be useful and meaningful to you so that you can use it and enhance and refine your approaches as you go along. So what is the process then that we imagine that we can take to at least start with creating the evaluation tool? Well, amongst the 5 of us now, if I can refer to you all as the networks within PCORnet, we do want to try and create a common instrument. to the extent that that common instrument can meet multiple purposes. And so we have program monitoring needs. We have internal assessment that we hope will be used to support you all as you do encounter your challenges and your barriers. And on your end, you have network enhancement. So you may have a plan or a design at the outstart, but as you continue, you'll be refining that over time. So we want this process then to be about co-creation. And as Sean had mentioned, there's no rest for the weary. We hope within the week the Patient Engagement Task Force will be meeting, and that will be the forum within which we will be creating this instrument. And in particular, we're going to be looking for a couple of things from you all. What domains are most meaningful and relevant to you? Who do you think should be responding to these assessments? The frequency with which you think that these assessments will serve you and your participants well. And then finally, the dissemination strategy to ensure that the data not only reaches your program planners and your designers, but also the participants that are in your network. And then my last question was, what do we hope to get out of this evaluation process? I've got 1 minute left and just one more sentence to say. It is to really not only enhance and refine the approach that you all are going to be taking and encouraging the peer learning that is part of the beauty of this network, but to also be able to have a body of evidence at the end of 18 months that we can say we now have a better understanding of what components and what characteristics facilitate and enable patient engagement and infrastructure development.
So, hi again. I'm Erin Holvey from Academy Health, and I wear a couple of hats, as I mentioned yesterday. One is as part of the Executive Leadership Committee. The second is working with Rich on the Governance and Collaboration Task Force, and the third is working on the internal evaluation or self-monitoring. So I'm going to keep this really brief. As our concept around the idea of this internal monitoring process has evolved, I think it's useful to think of some of these activities in layers. And so what I'm going to talk about today is how our activity is both a formative evaluation, and we also know that there are some important milestones at which there'll be conversations between all of you and your program officers to try and understand a couple of things about the progression of your projects. And so the internal monitoring process plays an important role in that. As Sarah mentioned, what we're going to make an attempt to do is to bundle our questions for all of you with the milestones reporting so that we minimize that burden. And I think it's also really important that we make an effort to be parsimonious because you all have so many things that you're trying to do over these next 18 months. So for now, at least, and we welcome more thoughts on this. I hope we can engage in discussion about it today. We're really thinking about sort of 4 domains of questions that we're going to add into, the milestones that Sarah mentioned previously. So those 4 sort of areas or domains of questions, in addition to the milestone reporting, are looking at products and outcomes, both of the anticipated and unanticipated variety, some of your participation and the value of participation in the task forces and PCORnet activities, some issues around sustainability and how those discussions are progressing, as well as other challenges you're facing and requests for support. And so, those are sort of the domains of the questions, but we wanted to really emphasize that these activities, I think, have mutual benefit for both PCORI and for the Coordinating Center and for all of you, as Sarah was talking about, in terms of maximizing the value of these activities. So not only are we assessing the productivity and effectiveness of PCORnet, which is clearly important for PCORI, but is also obviously important to this collective whole that we were talking about yesterday, the we that is here and on the internet with us. And then the second is to really identify opportunities for new collaborations, research studies, and other partners for the future. So as we learn about this process with all of you, we're going to see where some of those most promising opportunities are. And then third, and very importantly from the perspective of the self-monitoring or internal evaluation, is where can the Coordinating Center really provide more technical assistance? And that could not only include some of the types of things that Devin and Jeremy mentioned this morning, where there might be some consultation on particular issues or so sticky wickets that you're facing within each of your networks, but also more kind of policy development or specific guidance from PCORI. And so we really need to be thinking about how we can, and we'll talk about this in just a little bit, how we can ask some of those questions of all of you. I know it can be daunting to say, we're struggling here or we're struggling there with a particular issue, and we really want this internal monitoring process to help raise those issues before they really become bigger scale problems for any of your individual networks or for PCORnet as a whole, right? So that gets back to this idea that the we in this room, the group that's contributing to the development of PCORnet, really needs to work together and try and raise those issues, because it could have valuable input, again, not only for all of you, but for the network as we work together. So the other point that I wanted to emphasize is that, again, we're going to try and be parsimonious in terms of additional data collection, and that means we're going to use other sources of information that we have from the milestone reporting. So our internal evaluation activity will not just include the questions that we're specifically asking, but will really synthesize information from a number of sources. And of course, we'll provide all of that information back out to the group on an ongoing basis. So I'm happy to answer questions about that as we move forward.
Great, thank you very much, Sarah, and it's really a pleasure to be here at the birth of PCORnet, snowy birth of PCORnet. The external evaluation that Rand is tasked to lead is going to be very well integrated with the two evaluation activities you've just heard described, and we are planning, in terms of the layers, the metaphor of layers, to take a maximum advantage of the other layers of data collection that will be provided. I want to, before I go further, point out Justin Timby, who's in the audience. Justin, if you could just raise your hand, and Lauren Hunter, if she's in the room, she may not be here, who is also on the external evaluation team. So you may be asking yourself, well, you've just heard a lot of evaluation. What is the purpose of an external evaluation, given that we're just getting off the ground? And our answer to that is that we want to answer the question that an informed citizen might want to know the answer to. We want to answer those questions sort of at the end of phase one. What do they want to know about PCORnet and its evolution? And we're very much interested in taking the macro view of the formation of this new enterprise. So PCORnet is unparalleled. It's a bit unprecedented. And so from an external evaluator perspective, that's a significant challenge, because it's not clear necessarily right now what the end state will look like. There are probably some idealized versions of that. People in the room may have different idealized versions, and part of the process here will be to surface those. And so as this process unfolds, one of the things we'll be doing as an external evaluation team is trying to capture and document what those visions are and try to represent them. We actually have a slide that sort of describes this timeline a little bit. There's the PCORnet as it exists today. It has a past, a present, and a future as you move to the right. And then there's the PCORnet of the future. And what is PCORnet? Well, it's a network of networks. You've heard that. And it's actually a social network, and we're actually going to take advantage of the social network conceptual models to think about a PCORnet, which is essentially a set of people and organizations and resources. It's a set of activities, and then it's a set of communications of various types across these networks, the participants in this room and others outside the room. And we've left it deliberately vague, the way often these social network maps are left, as to what are those connections. And so one of the questions we'll be asking you to tell us about is what are the important communications that you want to have with each other and with the coordinating center. And Aaron and others will be collecting information on that we will take advantage of. There are a few principles that I just want to emphasize. And again, I'm not going to get into the details of the methodology here. But our purpose is to conduct an objective and independent and minimally biased analysis of the program over the 18 months. And there are a series of principles. The first I mentioned already is that macro focus. We're not going to be measuring the progress of individual CDRNs or PPRNs. We're interested in the formation of the network as an entity, the larger PCORnet as an entity. This is necessarily adaptive because it's evolving. Even as we've been in the room the last 2 days, there's an evolving understanding of what the PCORnet ultimately will be. We will use existing data. Much of what we're tasked to do is going to be document analysis, so it's analysis of documentation and observation. We'll be listening in on calls. We're happy to have people come up to us and tell us things. A fourth principle is that we're going to try to be scrupulous about maintaining confidentiality and anonymity of the things you tell us. And as we report back, we want to give you an assurance that we won't reveal identities or, and as we would do in any research of this type, we would try to protect that information. Unless you tell us you're engaged in criminal activity, that might be a different story. So that was a laugh line, but I guess it's falling asleep here. Or maybe they're contemplating criminal activity. So there are going to be 3 components to our evaluation. The first, Aaron has referred to as the process evaluation, actually Aaron and Sarah. And from our standpoint, it's the process related to the formation of the macro PCORnet, not the individual networks and their progress across milestones, but the progress of the creation of this PCORnet entity. We're going to be interested in the barriers and facilitators to that activity at a macro level. And then we're contemplating a capability evaluation at 18 months. Now, the ideal here would be to assess the outcome of PCORnet. And the outcomes of PCORnet might be, did it produce relevant CER results that changed clinical practice? That might be one outcome. But that's probably beyond the 18-month time frame. So instead, we're going to look at some of the interim capabilities that might lead to that future state. The capacity to generate new questions, the capacity to generate new study designs, new approaches that would involve the whole network. So I'm, I guess, right on time here in terms of my conclusions. I know that was a very broad brush. We do hope to do some interviews with you later in the 18-month phase to really get from participants what was the experience, what changed, what was difficult, what were the challenges, and what were the successes from your perspective. I think that'll be extremely valuable to understand the performance of this PCORnet entity. So thank you. I'm happy to take questions.
All right. Well, thank you to my colleagues. And we have about 15 minutes. I've put some questions up here, which perhaps was a bit of foresight because now that we're after lunch, I don't know how the energy's doing. But what I'll do is we'll just we'll wander I'll take the mic, I'll come down to you, and we'll see if you have any just general reactions to what any of the presenters have said, specific responses to the questions that are up here. So I'll give you a minute to have a look at those. And if anybody has any immediate burning questions, clarifying questions, this is your forum. So. We're going to get some time. Can you see the questions? How's the lighting? Oh, God. Okay.
Thanks. Very nice presentation. In the context of your external, you were created to report for the reporting of the PCORnet as a group, or to check what we will be doing for all the 29 projects. My question is for us in our project RPPRN, will we be reporting to you or to our program officer? How, in this diagram, where are we into play?
So I can start that, and I think that was part of the idea of a common instrument, because certainly you would be reporting to your program officer in terms of your accomplishments with regard to your milestones, but I think we recognize that as an opportunity to open up the dialogue to you all, because you may actually want to know what's happening with your participants. And to the extent that we can support and facilitate any kind of additional information you may want to collect, that would be possible as well, and we should have that conversation. So I do think that the hope is that we can dovetail the interests and have one time point where we're capturing all of the information. That's in the ideal, and we'll have to see how it actually ends up working in practice.
I would just say nothing that we're going to do will replace what you're going to be already doing for your project officer or other PCORI staff. We're really designed to stay as much as possible in the background, observe, analyze documents, analyze what has been reported, and then, as I said, later in the first phase, potentially to conduct a series of brief interviews to get more insights.
I also, actually, before going on to the question, I wanted to come back to another piece that I heard in your question, which was, and you can add on if I didn't hear it entirely, but the issue of individual network versus aggregate. And we as a group had discussed that, and certainly we would hope it would be both. That we would be collecting information from the 29 of you, and individually be having conversations about how things are going and helping you achieve your individual goals. And I think Academy Health will be involved in that as well. But then we also see value in aggregating that data at different time points and bringing it back to you and saying, this is what we're hearing from the network as a whole. And hopefully, to that extent, it would allow some lessons learned or failures encountered or successes.
Thanks. Jennifer?
Thank you. Part of our CDRN application included partnering with some folks who we find to be incredibly valuable partners in being external evaluators of our activities. And we're already planning, they've already been embedded in some of our early meetings, and we're having ongoing sessions with them where we can iteratively hear from them about what they see as our facilitators and barriers. Because we've learned the lesson that you ask 2 years from now, what do you remember about that experience? And we don't remember necessarily some of the best details. So is there a mechanism for some of us that may already have that within our internal network to liaise with the externals, especially around not doing duplicative interviews and asking the same questions, et cetera?
Yeah, that's a really interesting opportunity that I hadn't contemplated, but I did say that there was a tremendously smart group of people in this room who had a lot of experience in evaluation generally, and that we should be mindful of that. And I think it's actually a wonderful opportunity if we can create some sort of communication mechanism with external evaluators you may have hired for that, for your own CDRN purpose. I take it that would be very helpful.
Actually, you have go ahead, Catherine.
Yeah,
Mike's on the table.
I have a broader question, which is that I know as part of the health services, the health systems interaction task force, we have an assessment plan. I suspect other task force have assessment plans. PCORI has all these, assessments planned, and I wonder, and I'm just wondering, I'm concerned about overload on the part of respondents, and there's several ways we could address that. I mean, we could address it by planning together, which I think would be a good thing. We could address it by having some sort of consistent format we use and some agreement about how long these things will be, so that if I'm group health and we are part of one of the networks and we get a set of questions, I can trust that if I open that email, it's going to take me 5 minutes and it'll be done, and I promise you I'll do it fast if you keep my burden under X. So I just think, I don't know, I'll open that up and would welcome comments from other people too about that issue as we discuss these evaluations, which I agree are really critical. And some of it is information gathering to pose our, to help us with the activities we plan. Some of it is for evaluation, but I am concerned about overload.
Yeah, and we take that concern very seriously as well. And early on, when we were starting to formulate the formative evaluation, we, in recognition of the fact that many of the task forces do have some sort of assessment planned, our intention is to ensure that the coordinating center does help us coordinate that to the greatest extent possible. We don't want to go back to the well and ask people the same things that they got asked 2 weeks ago. I think that's a recipe for a lot of things. But suffice to say that we are aware of the task force's desire and need to do that level of assessment, and we are committed to making it as efficient as possible. And I don't know if the coordinating center folks or anyone else from PCORI wants to add on to that, or anybody from the panel.
Yeah, I was just going to add that we've spent a lot of time thinking about a coordinated approach, and I think it's one of the reasons that you see a lot of the focus in this discussion really being at a conceptual level, thinking through the domains and thinking about how that will overlap with some of the other information gathering and assessment activities. So definitely it will be an ongoing conversation with others at the coordinating center and the task forces about how to do this in the most efficient and parsimonious way that still generates the information that everyone's really going to need to do this well.
Right. And the only other thing I'll add is that among the PCORI staff that are part of this, there's a liaison from PCORI deployed to each task force who will be also keeping an eye out for that sort of thing. So, Sarah or Eric, did you want to say anything in response to Catherine's? Okay. Go ahead. Yeah, go ahead.
I'm not shy. I'll say it if Andrew doesn't want to say it. I will. I think these are great. I think we have to do evaluations for a wide variety of reasons you've outlined, both external and internal. I also am hearing that there'll be multiple versions, and so we need to consolidate. And I think our own groups are going to want to maybe add on some questions that will be useful for data that comes back. I would say two things operationally that might be, I suggest. One is I really warn against the. I have a prior PCORI grant, I have one now. I get about 2 million emails a week, but seriously, Academy, I get a lot. It's hard to actually pay attention to all of them from Academy Health when you get a lot about the same things. So I think that I would say parsimony regarding that will be useful. The other thing is perhaps we haven't talked much about what the steering committee, which is here, as well as others do, and this seems like the type of activity. So if there's a plan that's made, and then the task forces work together, that's the type of thing at a big picture that the steering committee should oversee and say, okay, I'm getting a lot of nods. So here's the plan, here's our reaction, and now implement or not. That way you get buy-in, because you can't say we didn't see it, which is useful. And you also get feedback because we say, whoa, actually, wait a second, the engagement task forces also wants to add 2 questions or not. So I just propose that operationally to our coordinating center.
Yeah, that's a great comment, and we will definitely. We're also considering whether there should be an evaluation working group, and that could either be kind of a subsidiary to of the steering committee. So we'll definitely figure out how to do the operational piece as efficiently as possible, in addition to collecting the data as efficiently as possible.
And I just want to follow up to your point. We had fully intended that this would be something that you could contribute to, and if there were questions. I was starting with the domains, but if you actually, all the way down to the questions, have things that you particularly would like to ask, that was what we were hoping to have happen, to supplement anything that we may already have.
The other thing is that we will have, both my patient co-PI and I will have regular communications with our team, so if we can give people a little warning, you're going to get a survey about this, your response rate and quality will be better, and it will not either be ignored or freak out people who receive it. I find that quite useful to others.
Mm-hmm. Great, thank you. By the people, for the people.
Question. So, you've got an evaluation, then we've got milestones that we're going to be measured against, and then there's a coordination technical assistant component. Is there a plan to have in-person site visits so you go out into the field and see what's actually happening?
Mm-hmm. There is not currently a plan to go out and do internal site visits, but that is something that would be appropriate to discuss.
Yeah.
Actually, go ahead, Sarah.
No, you go.
We internally at PCORI have discussed doing site visits, so that's definitely on our radar, and that is another avenue through which we would be collecting information. And to the extent we could coordinate what we learn from those site visits and bring it back to our evaluation partners, we certainly will do so.
Right. So I would say it hasn't been formalized that, yes, we shall visit each and every, but it certainly is of interest. And if your door is open, I'm sure we would be happy to knock on it. So we have just about 5 minutes. Kim?
So on behalf of the Coordinating Center, I just want to we are very worried about, can you hear me? I don't know. Okay. On behalf of the Coordinating Center, I just wanted to say that we are thinking a lot about the communication that you're receiving and the burden. And so we're going to be working really hard. The task forces are all part of the Coordinating Center. We're all a team. And so we're going to work very hard to make sure that we're respectful of your time, of the resources that you have, and of the value of the information that we're sharing both ways. Not only will we be careful about not sending too many emails, but we'll be careful about our communication platforms. And so we'll be inviting you to sort of an intranet type of thing that we've set up. And that will be a way to share information and for you to also share information with each other that doesn't necessarily have to go through us, but can be there for others to see. So there'll be all sorts of tools that we'll try to use. And basically, just keep in mind that if you are getting over-communicated with or you do feel a burden, please communicate with us. You can communicate with us at the Coordinating Center, with your PCORnet project officer. We're all working together as a team, so we don't want to find out about it 6 months later. So please feel like our doors are always open virtually.
Yeah, thank you.
Minnie Callon from UCSF. So could you tell us a little bit more about actionable reporting? So how are you going to, what are the ideas to make sure that as we're learning things across the nodes, that's being sort of somehow sent back to us? So for example, some of us will achieve some milestones a little earlier than others on some axes. So perhaps if there were ways to share the failures, certainly the successes, but the failures early and fast, I don't know through what mechanism, perhaps there are also dashboards and key metrics. Share any of your ideas on what you'll be doing to facilitate our learning as quickly as possible so that we can act on it in our individual nodes.
So I think this is where there's an inevitable tension between the information overload that Kim was just talking about, right? Because there will be information flowing from all 29 groups on a pretty continuous basis, and then there will be these junctures at which we're doing bigger data collection activities. So I think that we'll have to continue through the task forces and also through potentially an evaluation work group that we're going to put together, continue that dialogue about what are the best mechanisms to go back and share that information. How can we use the myriad of different communication tools that we have for making that information available, sometimes in more of a passive way, right? So putting it online and letting folks who have said they're interested in finding out about early opportunities know about those things. So some of that will flow through the evaluation activities, I'm sure, and then others will probably flow through the task force, through the coordinating center. And so we'll work together to find the best strategy so that it's not information overload.
Great, thanks. If I could just add that firstly, with all due respect, we do this assessment all the time about whether people want more email or less email, and it goes exactly down the middle. It's more email, please, less email. Email is the only thing I use, not. So just these things are really, really hard. It doesn't mean we go one way or the other, but it is really, really hard. So my sympathies to you. But my other recommendation might be to really think about very simple dashboards, maybe really helpful, where you just choose a couple. It doesn't mean it's the most important thing, but something that perhaps we can all contribute to that are sort of markers of where we're at, that tell us maybe now it's time to go and look at the passive, sort of the place where you go to get some additional information. It just helps to have sort of a North Star and a few little things that we're all looking at together.
Wow, I agree. For better or worse, we're at time for this session. We will make sure that you have a chance to respond to the questions that are up here. We want this to really be as inclusive and intentional as possible. Again, respecting the making sure that the information is calibrated so that it meets our needs and doesn't overwhelm. Please help me thank my panelists and thank all of you for being our fifth partner in all of this.
Thanks very much, Sarah, and all of you. That was a great discussion of a very important topic. So we're now coming to our last session. The snowstorm has stopped, the rain has stopped, the sun is shining outside. This is the last part of the time that we have together as a whole, the whole of PCORnet. And because this is a kickoff meeting, we've accomplished a lot of issues on the table. Let's try this again. Okay. So this is our last session together. We've accomplished a lot over the last couple of days, sometimes under difficult circumstances. But we did want to make sure, since this is going to be, the success of this network is going to be driven by the enthusiasm and motivation behind it. As Devin said, if this group wants to get it done, it can get it done. We wanted to make sure that all of the important issues were on the table and that you all had a chance to be very clear about some of the most important next steps from here. So I introduced this topic a little bit before lunch. I'm going to go through the detailed instructions and what we're going to ask of each of the tables here today to lead this last session in just a minute. But first, I'd like to turn to some of the leaders at PCORI and the leaders of the network, Rich and Rob, as if they have any comments to help frame these next steps forward. So, Joe, maybe we can start with you, and then Rachel.
Thanks, Mark. I think these comments might be valuable to make. They could be made at the closing of this session later on today, but I think it would be valuable to make. It's not amplified?
Sorry. So I think these comments would be valuable to make before we go into these table exercises where we put those burning questions that haven't been put on the table yet out there for consideration. So this has been a remarkable day and a half so far, and I think one thing that can certainly be said is that we all have a better common understanding of the goals of PCORnet, the way that patient engagement fits in, the challenges faced by the task forces. It's also very clear that we've talked necessarily at a high level because of the number of people in the room and because we are just getting introduced to it, and it's very clear to me that if we kept talking at this level, we wouldn't be very far along in 18 months. So what that points to, I think, is the critical importance of the task forces. And it is very clear that the task forces are where the work will happen, where each of you will formulate an agenda of activities. I hope you prioritize those activities and bring them back to the steering committee at our 1 month meeting. But I wanted to say, before I ask my colleagues if they have additional comments, I want to say one thing about milestones. The milestones essentially flow from the funding announcement. The funding announcement, we put a lot of effort into getting it right, but that was, 8 months ago now, and we've learned a lot in 8 months, and things change. And while I think each milestone reflects an important concept for PCORI, we also recognize that the collective wisdom that will be comprising each task force is better than our thinking 8 months ago. So while the task force need to be attended to, while the milestones need to be attended to, if a task force in its wisdom feels that the milestone no longer makes sense or more likely needs to be modified, Ken Mandel yesterday pointed to the surveys as one, and I actually need to go back and see what's in that milestone specifically, but that's obviously one that could be changed. The whole notion of the 3 cohorts is something I think that could be discussed, and some revisions could come. But the milestones stand until a task force modifies them, and that's part of the task force's mission. And so I was going to ask Rich, actually, if there was something to say about the plans for these task forces in the next, since they're really driven by the coordinating center.
Rich, do you need a new microphone?
Could I have this, please? Thank you. Here you go. So the reason I wandered over here was to get the real scoop from Kim. So I'll try to relay what she just told me, which is the packets that were distributed had information about the startup activities of each task force. Task force leaders will be reaching out to the identified members within the week. Our goal is to have the initial task force meeting within a couple of weeks. We do need to fill out the membership, because there are a few task forces that don't have the complete complement of members. And I hope it's very clear how important it is for every organization to be represented on each task force, because so much of the work that we're going to do is going to depend on the task force activities. So we're going to go from moving pretty fast to moving incredibly fast, and being able to participate in a task force meeting in the next couple of weeks is going to be a really important piece of what we do.
And so, Mark, I checked with Rachel and Rob, and neither one of them have additional comments now, so.
Okay,
not
not at this time, but I do want to keep you all handy, because we are going to have some opportunity to react to what we hear from the group. But right now, it's on to you all. So on your table, as I mentioned, there should be some index cards. What we'd like you to do is discuss for the next 20 minutes what the answers to these discussion questions would be. What's the one thing that you haven't heard about yet that you think is important for PCORnet to be considering at this stage, this critical stage of implementation? And then second, what are the two most important next steps for your organizations moving forward? Now, you just heard about the importance of the task force context for that. As you know, the task force are each covering some very important issues that need to be addressed together for effective implementation. And we also had some discussion yesterday and today about perhaps augmenting or extending some of those task forces. Patient leadership, engagement of healthcare systems are examples of that. So these can be tasks for your organizations or for your organizations as part of PCORnet or a PCORnet task force. And we're asking you to hit the two most important ones. So please spend the next 20 minutes discussing at your table. I know this isn't just the people on your task force or just the people from your own organization, but that's part of the point. We want to get this discussion going across organizations. And then we're going to go around the room and hear from each of you, and we'll do that hopefully with Rich and Rob and Joe and Rachel available for some comments and reaction along the way. So 20 minutes, we'll get started again at about 2:10. Thank you all.